Hello, welcome to my presentation. My name is Ahmed Khaleel, and today I'm going to talk about veracity in the nursing context. I will be discussing about veracity, how it is thought about in the society and in healthcare, how veracity is important to nursing, and why the professional codes cannot be exercised without veracity. We'll conclude with two examples in the nursing practice. What is veracity? It is the duty that one has to tell the truth. The society expects a moral person to exercise honesty, be straightforward, and to be true to oneself and the world around you. Veracity is strongly linked to autonomy. For patients to make autonomous decisions, they need to know the facts. Risks in surgery are needed to be disclosed so patients can decide for themselves. In therapeutic privilege, you are withholding information for good. For instance, about family member being killed in a car accident when the victim themselves are unstable. You are looking for any harm as a consequence. This is further supported by the concept of relativism. Certain cultures make family-centered healthcare decisions and withhold information that can cause possible harm, doing the benefit and causing less harm. Veracity in nursing, it is telling the truth. It is a major part of your accountability. Not only nursing is a protected profession, but also the most trusted profession above physicians and school teachers. We as nurses should keep up this trust. Legally, nurses are expected to find the capacity to consent in their patients, take consent before providing any care, and are obliged to exercise reasonable care and skills in their approach. Why is veracity important? It is very crucial for establishing and maintaining a relationship of trust between a nurse and a patient, especially when patients are vulnerable when seeking medical care. You achieve this trust by implementing the six principles, which is accountability and making the right choice for the patient, providing compassionate care, and putting patient above all interest, providing just care with no harm. Deontology further strengthens veracity in nursing and emphasizes on doing your obligatory duty as a nurse and assist the patient irrespective of the consequences. However, there can be challenges. There can be an implicit bias, also called unconscious bias, amongst the nurses that affects the care delivery. It is based on an individual understanding of race, ethnicity, age, sexual orientation, and gender expression. Research suggests there is a huge gap with culturally appropriate care. For example, biased nursing care towards the LGBT plus community. Let's look at how veracity is related with the professional codes. Veracity is integrated in the professional codes. Without veracity, one cannot exercise these codes. The International Council of Nurses have codes of ethics for nurses that act as a framework for ethical nursing practice. Veracity forms a strong grounding here. Five stand out to me, where you need to give accurate information without being biased to patients so they can have autonomy and make informed decisions. Also, nurses need to practice within their scope and be honest about their skill competency. Only if you're unbiased, you can advocate for your vulnerable patients honestly. For example, when errors and near misses happen, nurses must exercise open disclosure. The Nursing and Midwifery Board of Australia has Code of Conduct for Nurses which is enforced in each state and territory in Australia to protect the public. There are 11 principles and you need veracity to exercise all of them. Three stand out to me. One cannot provide safe patient care without being honest. You have to be honest with care and disclose the associated risks involved so patient can have autonomy. A nurse needs to provide bias-free care and do no harm to the patient in any shape or form. So this gives a little idea where you need veracity to exercise your profession from starting to the end. Veracity has to be there. Let's look at ethical disagreements in the nursing practice. What veracity is asking you in these two cases. The first one, recurring hospitalization of individuals with a history of opioid abuse. Caring for such patients has become challenging for nurses. Either nurses hesitate to give pain medications from bias or from the fear of contributing to the addiction. Study says if nurses are not properly educated with opioid abuse treatment, this can lead to biased assessment and, as a result, ineffective pain management. Here, veracity says that a nurse should act by doing good, cause no harm, be honest with assessments and risks involved. The patient can make decisions for further treatment. In the second case, a nursing student flashes the central venous access device under supervision of buddy nurse, not knowing that the normal saline pre-filled syringe had medication. As a result, the patient was hypertensive and had to go to ICU. Veracity over here tells you that you should be honest, work within your scope, and and cause no malfeasance to your patient. So the student nurse should have said, "No, it's not within my scope. I cannot do it. Sorry." Moreover, the body nurse also had responsibility here. They both were in breach of their duty of care. They were negligent and they caused maleficence, unintentional maleficence to the patient. Moreover, they have worked out of their scope. In conclusion, I have discussed what veracity is in the society and healthcare context and how it's related to nursing and some challenges associated. I've also discussed how it forms the grounding platform to the professional nursing course. And I've taken two examples and discussed what veracity is demanding of you, what you should be doing in terms of veracity. Thank you for joining me. Here are my references.